We are back in Barranquilla, Colombia for another medical tourism trip. Those who have been following my journey know that I began this medical tourism trip around 2 years ago, which invited Americans to come down to Colombia in order to access healthcare. This is on the tail end of the COVID-19 pandemic, which resulted in many Americans losing their jobs and therefore losing their health insurance, because unfortunately in the United States, health insurance is tied to people's employment. And so with that loss of job, millions of Americans went without health care because they didn't have insurance. So they were unable to see their doctors, get their medication for many months and sometimes years. So I created this business in order to help Americans access health care. Just because you don't have health insurance does not mean you should be without health care. It is a human right in many countries, unfortunately not in the United States. And so I began inviting Americans to come to Colombia because Colombia outranks the US as well as Canada. It has become an international hub for healthcare for not only Colombians, but Canadians, Europeans, Americans, Australians, because they recognize it as the gold standard for healthcare. Not only is the healthcare in Colombia extensive, innovative, and robust, it's also inexpensive, especially when compared with the US market for how healthcare is priced. In many instances, healthcare costs in Colombia can be sometimes 60 to 70% less than what an American would be paying in the United States. So you understand why Colombia is the mark, the place to be when it comes to healthcare. Also, it's relatively close to the United States, and so it's not a burden for Americans to be able to travel to, it's about a 6 or 7 hour plane ride. So it makes it feasible for Americans who are interested in becoming a medical tourist to travel to Colombia. So what would it be like? What would a week be like if you become a medical tourist with Access Wellness Abroad? I would advise that client land either Friday, Saturday, or Sunday, so they have a few days to rest, to acclimate to the temperature, because they'll be exhausted from the flight. Colombia is around 6 to 7 hours from the United States, and right now there's no direct flights. You do have to make a layover in Bogotá, Colombia, in order to get to Barranquilla. So that person, I would like for them to have 2 or 3 days to rest. That Monday or Tuesday is when appointments will begin. And so that person will have the opportunity to meet with their specialist, to meet with their team of doctors first. So that would be the first set of consultations. That doctor, those doctors will then order blood work and testing for that patient to be done. The following day, which would be a Tuesday or Wednesday, that client will then do their diagnostic work. There will be 3 sets of testing for that client. There will be fasted blood work, which means the client will not eat by a certain time the day before. And then after that client does that blood work, that client will have the opportunity to eat and then return to the facility in order to do the second set of unfasted blood work. So the testing for blood work will begin around 6:30 in the morning. They do their blood work. The client will be told, you can go and eat, come back in around 2 hours, and they will do the next set of blood work. So once that next set of blood work is completed, that client will then be ordered to do sonograms, any x-rays that need to be done, sonogram, x-rays, or MRIs that need to be done. So that will be dealt with in the afternoon. All of this testing will be done in one day. Within 24 hours, that client will also receive the results from their exam. Those results will also be sent to the appropriate physician. The following day, let's say it's Wednesday or Thursday, that client will then have a follow-up with that physician to go over said blood work, to see what needs to be looked at some more, and if additional blood work needs to be done, then the following day blood work will be scheduled. Again, the person received their blood work within 24 hours, very rapidly. Another thing to note, I'll address HIPAA later on in the video. To recap, Monday, Tuesday, meet with the first consultation of doctors, following day testing, Following day after testing, you have your blood work, you have the second consultation. If additional blood work will be done, it will be the next day. So as you can see, very efficient. Dental work. If the client needs dental work, that might be a little more dynamic, but essentially the process is the same. They'll meet with the dentist. The dentist will order whatever scans need to be done. They will go the following day to get the scan work. The scan work is sent to the dentist, and then they'll have their follow-up meeting with the dentist. What tests are done? There's no way for me to generalize exactly what tests are done. That is specified by your doctor. But the good thing is everything is done in one day in one facility. Blood work, sonogram, x-rays, all done in one place. There will be translation services available. I will be translating, as well as I have another team member that will be translating if you have any questions or need additional services. You don't have to worry about not speaking Spanish. Everything will be translated to provide as much ease as possible. Okay, regarding HIPAA, there is no HIPAA because this is not the United States. So you do have to be comfortable with trusting the process and that the facilitators knowing about your health condition. So if there's something that you feel uncomfortable with, please let me know so that I can be as discreet regarding your diagnosis or your health care needs as possible. But there is no HIPAA. So I just want you to understand that HIPAA does not occur outside of the United States. Also, none of this information is reporting to health insurance. This is also important. Your health insurance, your Medicaid, your Medicare, whatever health insurance you have in the United States is not applicable in Colombia. So if you have questions regarding, can I get reimbursement of that with Medicaid or Medicare, probably not. They're not interested in any of the United States health insurance. If you have international health insurance, you may be able to submit certain claims for your costs to the international health insurance company, but I'm doing some more research to provide more information regarding that. Most of the appointments are going to be completed by 4 p.m., so you do have the opportunity to enjoy the rest of your evening, and most of the appointments start. So you will be seeing doctors and dentists between 8 o'clock in the morning to 4 p.m. You will have transportation to and from all of your appointments, as well as lunch will be provided. Some of the offices close for lunch. Some of the doctors go on lunch break for about 2 hours, so you'll have some breaks in the day. Also, what's important is that it's a very tiring day, so I do want you to manage your day and not make too many social plans because you will be testing. You won't be waiting around for a long period of time, but meeting with several doctors a day, getting blood work done, and then the heat, if you're not acclimated to a tropical climate, that could make you more tiresome. So I want you to manage your social calendar regarding that. Who are these doctors? Many of these doctors have been educated in the United States and Europe. They have extensive background. You will have their information beforehand, and you will have the opportunity to meet with them via Zoom before you meet them in person. And I must say, they are the gold standard when it comes to physician. Not only are they knowledgeable regarding their zone of genius, but they are so compassionate. When I say exceptional bedside manner, warm to the touch, gracious, kind, listening to their patient. It's a wonderful experience to be with these doctors and these dentists. And so it can, if you've lost faith in the healthcare industry in the United States, I can assure you Colombia will restore your faith in physicians, because these are physicians that absolutely love what they do. You could see it comes across in how they deliver the care to their patients. Also, what's interesting about medical tourism, I did not know this a few years ago when I started this, is that Colombia has a preventative health model where every person every Colombian the preventative health care model is based on 3 months. So everyone is tested and retested every 3 months rather than biannually or annually like in the United States. So I thought that was really interesting. And so they're interested in you retesting in 3 months. So if you think about becoming a medical tourist, perhaps it's difficult for an American to travel to Colombia every 2 months, but if you are a retiree, it's just something for you to think about, that returning every 6 months or every year for your annual checkups is something to think about. That is the standard for Colombians to maintain their health, to make sure people are screened appropriately, that there's nothing that arises and that person does not have the opportunity to see a doctor for several years. And so that's really, that blew my mind, that everyone has testing done every 3 months. Especially if you have a chronic condition, that's really something for you to think about. In terms of accommodations, I have Airbnb set up as well as hotels. So if you let me know if you prefer a hotel or an Airbnb, you do have those two options. In terms of Airbnb, that's an option for someone who prefers to do their own cooking and enjoy a kitchen. And also there will be someone that you can have that comes and cleans up as well. So that's not ruled out if you're concerned about that. And as you know, a hotel will provide room service and things like that for you. Please let me know if you have any additional questions in the comment section. I'm trying to think if I missed anything. So you understand what the schedule will be like. How much is the commitment? 2 weeks to 3 weeks. I know it seems like a long time for Americans to take away from the United States, but this is really about accessing healthcare. Americans are becoming more chronically ill, not only as a result of environmental factors like the food, the drinking water, the stressors, but also because the lifestyle. And so becoming a medical tourist is really taking the reins of your life and saying my health is more important, because it really is. I knew this when I started this business, but it's become even more important to me that healthcare is really the luxury right now that Americans should be fighting to access. And if that means you have to travel to other countries to access it and you have the means to do so, then really think about that, because America's not changing its healthcare model anytime soon. But that doesn't mean that your health has to decline, that you can meet with a team of intelligent and compassionate doctors so that you can go back to the United States fortified, knowing that you've gotten testing done and that there's not this loop playing in the background that you're wondering if your doctor ordered an extensive amount of testing to rule out any root causes. So becoming a medical tourist is really essentially being a pioneer, but taking charge of your health in a way that it was not modeled for you. So I understand anyone being reticent in that, and you think your home country should provide it. Perhaps it should, but in the meantime, do what you can to access it. So if you have any other questions, please let me know in the comments section. I'm going to do a follow-up video with my favorite patient, so she can do an explanation regarding her experience regarding medical tourism on her second round and what she has learned. And she is of retirement age. So those of you who are planning your retirement, you're concerned about retiring in another country, you want to know about the healthcare in that said country, really think about Colombia. Also, I want to mention that Access Wellness is not only about medical tourism. I do help Americans relocate abroad. Colombia being a popular country for many Americans because of their healthcare. And I have a whole slew of videos dedicated to why Colombia, why certain countries, and what should be part of your framework with deciding on what country to move abroad to. So let me know. My information is in the description box, and I'll see you soon. Bye-bye.